This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about when rotator cuff repairs fail. If you like this video, we put out new content weekly, so please like and subscribe. So rotator cuff, maybe you've injured your rotator cuff, maybe your mom's had it repaired, maybe you've had it repaired. Basically, what the rotator cuff does is it holds the shoulder joint in place. Most of the movement of the shoulder actually comes from the deltoid muscle. It's much bigger, but the rotator cuff holds everything where it's supposed to be. And when you tear it, the humeral head starts moving around and it can be very painful. So a lot of times people have shoulder pain, they'll go therapy, injections, doesn't get better, they get an MRI, it says they have a rotator cuff tear, and then the surgeon wants to repair it, so they repair it. And then sometimes they fail. What does that mean? It means that the surgeon took their rotator cuff, tacked it back down using suture anchors, which are almost like drywall anchors, except made for the human body, but they have very strong sutures coming off of them. Anyways, and then it tears again. So why does that happen? It happens because most of the time, the tissue of the rotator cuff is not good, meaning that it's been torn for a while, the muscles may be slightly atrophied, and sometimes when it tears, it doesn't stay where it's supposed to stay, it moves all the way back. And so they have to pull it back over. And you can imagine if this tissue is not good tissue to begin with, and you're pulling it back over and tacking it down, how it could tear through again. So what will happen is they'll repair it, the surgery will be a success, the person will be working in physical therapy, then a couple weeks later they go, ow, I heard a pop, and then it hurts again. And then you get another MRI, and it shows that the rotator cuff is re-torn. At that point, you could repair it another time, but most of the time, you know it's not going to work. There's other fancy shoulder things like superior capsular reconstructions, or they have grafts they use. So instead of having the rotator cuff here, they'll actually attach a graft to it so they can connect it. Those are plus or minus work, okay? But honestly, for most of these people who end up re-tearing, they're on the older side and they're kind of headed toward a shoulder replacement called a reverse shoulder replacement, where you can essentially ignore most of the rotator cuff when doing it. But if you have your younger, healthier patient who has like an acute rotator cuff tear, those don't tend to re-tear quite as much. But generally speaking, when a rotator cuff repair fails, it's because the person's older, the rotator cuff is not in a good condition to start with, and it's retracted, so they have to pull it back down. That's when you're looking at failure. It happens all the time. It's very frustrating, but that is when it happens. So I hope I was able to answer your questions about when rotator cuff repairs fail. If you like this video, we put out new content weekly, so please like and subscribe. If you have any medical questions I didn't answer, feel free to leave them in the comments below, but I can't give you any specific medical advice about your condition because this video and all my videos are for educational purposes only. Thank you for watching.